Okay, now listen here. So here we will be discussing what are the physiological effects of smoking. One important problem with smoking is that smoking has been increasing in your generation. In our generation, it was actually very much lower. But nowadays, I can see that so many people, including women, are smoking. Because I am coming from Cochin, and there are a lot of people, a lot of girls also I can see smoking. And even I used to go to many other countries also, but compared with the many other countries in Kerala, smoking is maybe also in India, smoking is far less common. But if you go to many countries like Australia, or you go to countries in South Asia also, I can see many people smoking. So in the Kerala is somewhat better, but in your generation, somehow the smoking is increasing. That is not a good trend because compared with the alcoholism, smoking is more dangerous than alcoholism. Alcoholism is also creating a lot of problem, but smoking is creating more dangerous side effects, dangerous health effects compared with alcoholism. And we will see what are the main problems of smoking. So one problem with the smoking is that it will be introducing a lot of harmful chemicals into your body, and that will be affecting your blood as well as blood system, circulatory system, as well as your respiratory system. Now, one of the major chemical introduced by the smoking is nicotine. Now here, as you can see that it stimulates the release of adrenaline. That is why when people are smoking, they feel and increasing the heart rate and also blood pressure. These are the reasons why people are going for smoking, to get some sudden increasing energy level. That may be the because adrenaline is a hormone that activates almost all the systems in your body. So when you are smoking, adrenaline is released, heart rate is released, blood pressure is increased. So the person feel more energetic. That may be the reason why people may be smoking. But and nicotine also constricts the blood vessel, reducing blood flow to the vital organs and peripheral tissue. So this is where the problems also come. When it is increasing heart rate and blood pressure, actually adrenaline is always known as an emergency hormone. It is actually preparing your body for either fighting with someone or escaping or flight. We always use the name fight and flight. Adrenaline, either when there is some kind of emergency, for example, someone is going to attack you or fight with you, your body will be immediately releasing a lot of adrenaline, and that adrenaline makes you very energetic, so that you can either fight with him or her, and or if you feel that there is no scope in fighting, it is better to run. In that case also your body is preparing, adrenaline is preparing your body to run fast and escape from that dangerous situation. So adrenaline is a hormone preparing your body to survive in a dangerous situation. So that is why it is increasing the heart rate and blood pressure. But at the same time, it is also reducing blood flow to peripheral tissue. Peripheral tissue means the outer part, like skin, outer portion of your body. To that level, to that organ, it will be reducing your blood flow. Then chronic exposure leads to addiction, withdrawal symptom, making quitting is extremely difficult. So this is that is a person is taking this nicotine every day, several times every day, then slowly he or she become used to it. And without that, if the body may be exhibiting a lot of difficulty. That is what we used to call the withdrawal symptom. Then tar. Tar means the same. Tar means tar that you are seeing in the road. When you mention that cigarette smoking contains tar, it is not a different tar. It is the same tar that we will be using for tarring the road. That tar is also introduced by cigarette smoking. Tar consists of toxic chemicals that damage lung tissue. It adheres with the lung surface and paralyzes cilia, which will be responsible for clearing mucus and debris. For example, when we have some cold infection, our body is producing a lot of mucus, and that sometimes that mucus comes through our nose or also through our throat, and that mucus will be destroyed by this tar. So the purpose of that mucus is actually to prevent the bacteria from developing. Most of this mucus will be containing a certain substance which can kill bacteria. So when that mucus is destroyed, what happens is that bacteria can develop in the lungs. I will show you some pictures of how see, maybe some pictures will be there. See, this is how what is actually happening. See, this is the normal lungs and how the lungs can be changed as a result of cigarette smoking. So this is the problem of the, see here also you can see that it can completely change. This is also another picture. So this way the cigarette smoking can completely damage the very fine structure of the our lungs. See here, this is another lungs. Here there is a comparison between the lungs of two different persons. This is a normal lungs and this is a lungs of a smoker. So this is what is happening in the case of cigarette smoking. You can also see that. See here also you can see that. So it is, though externally there is not much difference, internally your body is actually slowly getting destroyed. So this is what is happening in case of cigarette smoking. Then another problem is that this leads to mucus buildup. Chronic inflammation contributes to chronic obstructive pulmonary disease. I will also show you what is COPD. Chronic COPD. COPD is also a dangerous disease. Here also you can see that. Now in the case of COPD, what is happening is that this is the problem in COPD. See here you can see that normally this will be the diameter of the respiratory bronchus or trachea, and during a COPD this diameter will be reduced so that less air will be able to reach your lungs. So that is the problem with the COPD. So smoking will lead to that situation, chronic obstructive pulmonary diseases such as chronic bronchitis as well as emphysema. So actually this emphysema is most commonly caused by cigarette smoking itself. I think in last class I showed you how emphysema is affecting the alveolus. Alveolus are small sacs. That the internal structure of that alveolus will be destroyed, and the cigarette smoking will be also causing this emphysema. So that is the effect of tar. So one chemical is nicotine, second chemical is tar. Then we have carbon monoxide. So in case of carbon monoxide, we know last class we see what is the carbon monoxide is 2240 times more stronger, more attraction than oxygen. So in presence of carbon monoxide, hemoglobin will be combined with the carbon monoxide. So reduce the oxygen carrying capacity of the blood by binding with hemoglobin, making the heart work harder to supply it. That is, when carbon monoxide is combined with hemoglobin, oxygen will not be transported to various tissues and organs. Over time, this results in damage to cardiovascular system, increasing the risk of heart diseases and also stroke. You know what is a stroke? That is when certain part, when there is a block in one part of the blood, one certain blood vessel, especially if it is to the brain, some area of the brain may not be getting blood and that will be damaged. and that is what is known as the stroke. Now here the long-term effects of smoking is that it is a major risk factor for lung cancer. Lung cancer is one of the type of cancer which is 99% caused by cigarette smoking. Otherwise it is not common. The stomach cancer is common, the uterine cancer is common, other type of cancers are common. But this type of cancer, which we call as a lung cancer, is almost always caused by cigarette smoking. Here you can see around 85% lung cancer linked to smoking. Then chronic respiratory disease like COPD, and that will be slowly worsening, reducing the lung capacity. Lung capacity means a lung volume, and difficulty in breathing and premature death. So that is also a problem. And smoking also affects reproductive system, reproductive health, reducing the fertility in both men and women, causing complications of during pregnancy, like low birth weight, developmental issues in fetus. Nowadays, you know that many people, especially after the marriage, you know, many couples are facing a lot of difficulty, especially, and that may be a problem of the new generation. You can see normally around 10% of the couples are facing some kind of infertility. But now I think it is increasing. Maybe a lot of factors are there. Our new style of life, our new use of mobile, continuous use of mobile, all this, because all this kind of thing, if you check the effects on mobile because this is 5G. Most of our phones are now 5G. 5G is actually producing more dangerous levels of radiation, and these mobile companies will never accept such thing. But they have. So it is always better to keep mobile as far as possible closely away from your body. But girls usually keep it in your body. With regard to boys and men, they are always putting it in either in their pocket or in their pants pocket. And this radiation, this is actually microwave radiation. Now microwave radiation means heat radiation. And that heat radiation can damage especially in the case of men, it can damage the production of sperm. So that is the problem with the mobile radiation. But there are a lot of research on that, because our corporate companies always suppress this research. They will fund another kind of research, and which says that it is absolutely safe. So those who are research, even the research data, true research data will never come, because nowadays everything is controlled by corporate business people. What makes them, what is good for them only will come out. Other kind of news will never come in the news channels, because even the news channels are also controlled by these big people. So ordinary, and otherwise we need to search for that, then only we will be able to know what is the true reality here. So what I am saying that in case of cigarette smoking also, it has a lot of complication. So all this kind of can affect the fertility of the person, leading to lot of issues during the time of pregnancy. The increased risk of cardiovascular disease, coronary artery disease, strokes, and peripheral artery disease. Peripheral artery disease means blood vessel going to legs. Such kind of, there will be a lot of problem. I will show you some picture of how a peripheral arterial disease will be affecting. See, this is what is happening in the case of peripheral arterial diseases. See, here also the situation is somewhat same. What is happening is that this diameter will be reduced. So that is especially in the blood vessel going to the legs. So that those tissues in the legs, they may not be getting enough blood. So there will be a lot of complication. Here also you can see that this is also a situation of peripheral arterial disease. Here you can see that. See gangrene, then non-healing ulcer because the blood is not coming properly. So some tissues there will be slowly dying, and this is known as ischemia. So these kind of problems will be occurring as a result of cigarette smoking. Then we will summarize some of the key effects as far as the lungs are concerned. That will be causing chronic bronchitis, emphysema, and cancer. As far as heart and blood vessels are concerned, it causes arteriosclerosis, thickening of arteries, then heart attack, stroke, poor circulation. Then coming to brain, nicotine of addiction leads to brain, changes the chemical nature, biochemical features of the brain, leading to dependence and withdrawal symptom. It will be changing the brain nature of the biomolecules in the brain. So, or like neurotransmitters will be there, that will be changed. And as a result, the person feel a dependence, a kind of addiction. And without smoking, he or she cannot manage. Then digestive system, it will be leading to ulcer, cancer in the mouth, esophagus, stomach, and pancreas. So these are the problems in the digestive system. The immune system is there. As far as immune system is there, that will be weakening our defense, increasing inflammation. So when a person is smoking, he or she will be more susceptible to more bacterial infection or viral infection. Then skin and appearance makes the person aging, accelerate or increase the speed of aging, more wrinkles on the skin, slow the rate of wound healing. So it is actually a lot of complication. But still people, even though people know all this, just for the sudden spike in energy level, they are going for that. But long-term effect on the body and also on the family life of that person is too much. Reduce the fertility, raises pregnancy complication, causes problems with the erection of the penis. All this can be problems of the smoking. So even though there are a lot of problems and most of the people know this problem, but still many of the people choose to smoking. I think the main reason is that they get some sudden spike in energy level. For that they are going for that. But actually this is where we have to develop more. Many people may be going for that because they may be feeling depressed, they may be feeling lonely, or they may be having other kind of social or psychological problem. Then that may be the real reason why people may be going for smoking. So it is to feel that I am okay. To get that feel of I am okay, people may be smoking. That is the same reason why people are also going for all kinds of addiction, like alcoholism, smoking, or drug use. For everything, people are going primarily to get that feeling that I am okay or I am stronger. I am very strong. So that kind of feeling, for that kind of feeling, people may be going for that. So this is an idea of how cigarette smoking can affect your body.